Now to Know Your Mind, today a discussion about recognizing depression. It's a potentially deadly disorder, but the symptoms can be subtle, so people delay getting treatment. Those symptoms include a lack of interest or lack of pleasure, poor concentration, and changes in appetite. With me now is licensed psychologist Monica Campbell. She has more than 20 years of experience and also has a practice in Philadelphia. So Monica, thank you for being here.
Thank you for having me, Stephania.
So we want to get to those symptoms because the thing is that they can get missed so early. But first, we also want to talk about depression, what it is and how serious it can be.
Absolutely. So I first want to differentiate between sadness and depression. So everyone gets sad. It's a normal part of the human experience. But depression, and as we think about what's called major depressive disorder, is a little bit different. So that's sad mood or lack of interest for a period of at least 2 weeks. And with that sad mood or lack of interest come a lot of other symptoms that people don't often think about as being part of depression. So everything from poor concentration, changes in appetite, changes in sleep, and, left untreated, thoughts of death and suicidal thoughts can also occur. So I always like to say to people that untreated depression can kill you because people start to think about suicide.
And the way you just said this made me think, do these symptoms happen all at once or are they gradually showing up?
Great question. So not everyone gets all symptoms of depression. There's about 9 symptoms that we look for. And so to be diagnosed with what's called a major depressive episode, you need 5 out of the 9. And depression can look really different on different people. So for some people, they're sleeping so much, they're sleeping a lot every evening or during the day, maybe sleeping 10 or 12 hours a day. And then for other people, they have a really difficult time sleeping. So maybe they're having trouble falling asleep or staying asleep. Similarly, are changes with appetite. For some people, they're eating a lot when they're depressed. They may crave specific foods and they may gain weight as a result. For other people, they have very little appetite and then eat very little and as a result start to lose weight. So depression can look very different on different people.
I'm glad that you brought that up because it seems like a lot of those symptoms that you brought up seem like withdrawn symptoms, right? You're kind of just taking a step back from the things that you used to enjoy. But is there ever a moment where someone who's depressed might be more active, maybe to hide these symptoms?
So that's an interesting question. For some people, they tend to get over busy to avoid maybe dealing with how they're feeling or things that have recently happened for them. So I think that's kind of less likely. There's also a symptom of depression called psychomotor agitation. And for some people, that looks like fidgetiness, a lot of restlessness. So they may actually be moving more, even though they're feeling quite depressed.
All right, so you've also said culture is not helpful when it comes to depression because, people are being told to shake it off, which we all know doesn't help.
Yeah, it's a really unhelpful message to tell people who are depressed to just shake it off. And although faith can play a huge role in recovery and healing, also messages that we just need to pray about depression is not really helpful. Depression is a brain issue that involves brain chemicals that are either not working properly or there are not enough of them. So we really need to look at it as a medical issue.
So you just mentioned chemicals, medical issue. What are the treatments here? And do they always require medication?
So medication can be very helpful, but there are a number of treatments for depression. So the first one would be therapy. So finding a good licensed therapist that can really work with you to develop coping skills and help you better understand what's happening with you can be really helpful. Exercise is a huge help for people with depression. So there is research that consistent exercise in which your heart rate is raised can actually be as helpful as medication for depression. And then lastly, I do want to mention medication. Medication is extremely effective for depression. Some people have hesitation about taking medication, but it can really help jumpstart you so that you can access those other coping skills like having enough energy to exercise or wanting to engage with other people. So medication can be really, really helpful. And I can't stress enough that, especially if you're to the point where you're not functioning because of depression, maybe you're calling out of school, calling out of work, or not going to school, or not taking care of things that you need to take care of, or if you're thinking about suicide or having a lot of thoughts about death, that's definitely a time to think about medication as a treatment option.
Licensed psychologist Monica Campbell, thank you for joining us today.
Thank you for having me.